Empty Nose Syndrome, brought to you by the Modern Nose Clinic. We know your nose. So this is Doug Skarada, and I'm at the Modern Nose Clinic, and I kind of have a sad topic to talk about today. It's empty nose syndrome. I thought I might show you my fishbowl, which is my office, before we get started. So this is where I live. I'm going to go backwards. This thing here says 22 in the car backwards because I'm holding my phone backwards. And we are a SNOT 22 clinic, so I love that number. And then over here I've got my workspace, which I'd love to tell you is super clean, and but I'm obviously blocking a lot of stuff. And dry erase board. I'm a creative person and I'm very visual. So anyway, I'm going to walk on out and we're going to talk about a somewhat sad topic today, which is empty nose syndrome. Okay. So since this is somewhat of not a happy topic, let's get some privacy in this room here, okay? This is actually one of our clinical rooms here. So empty nose syndrome is something that, first of all, it deserves a lot more attention than it gets. I had someone comment on one of our other videos, I think it was physiologic nasal airflow, that they had empty nose syndrome and how terrible it was. And I promised them that I would make a video on this topic. So it's a bit late coming, I apologize, but here it is. Okay, so empty nose syndrome, when you read about it on the internet, and I encourage you to read a little bit about it on the internet, there's a couple of incorrect things. For one thing, they say that it's a rare disease and some ear, nose, and throat doctors are unsure if it really exists. Oh, it exists. There's no doubt it exists. And really, if an ear, nose, and throat doctor bothers to go to any rhinology meeting like the American Rhinology Society, which is fantastic, plug for them, there's no one there who would tell you otherwise. So I wouldn't call it controversial in regards to its existence, but it's unclear why people get it. I can tell you some general terms or general ideas to consider. It seems to happen when the nose has been overly resected. So if any of you out there are considering getting a nasal surgery, take your time and think about this potential complication. So at the Modern Nose Clinic, we have a philosophy of preserving normal anatomy. That goes across all of our lines of care. We have this idea that the nose is designed the way it's supposed to be for a really good reason. And so we take a very conservative and careful approach to modifying the nasal anatomy. Whenever a person will resect the entire inferior turbinate, for instance, and in all fairness, I did this before also, so I'm not going to say that I'm above this. In case there's an ear, nose, and throat doctor watching this video, I think that across the country, this was something that was routinely done and still done, where there's lots of destructive techniques for treating the inferior turbinate. So me personally, I don't do that anymore. So I would say I'm a reformed inferior turbinate abuser. We have a whole bunch of techniques where we actually shrink down the inferior turbinate without using electricity or cryotherapy, or coblation or other destructive techniques. And it's beyond the scope of this video, but I would say that being somewhat conservative in the treatment of the inferior turbinate is the first place to start. Take a look at my physiologic nasal airflow video and you'll see what happens if you resect the inferior turbinate. All the airflow will move along the floor of the nasal passageway. Let me show you. So this is a very typical anatomic chart you'll see in an ear, nose, and throat clinic. And this piece here shows the inferior, the middle, and the superior turbinate. And what most ear, nose, and throat doctors do is resect this. And I just saw a patient yesterday treated here in town by a physician, and the physician said he had never seen a patient with empty nose syndrome. And the patient came back multiple times and all of the symptoms were consistent with this. What happened was they had almost this entire structure resected. So air flows into the nose along the floor and down the back. You're not ventilating the upper 90% of the nose, and therefore you're basically crippling the nasal airway. You're not going to filter out dirt and dust. You won't smell food or olfactory smelling particles that move across this olfactory nerve. You won't humidify the air, warm the air, condition the air. So if you go skiing, it could really hurt your nose as the icy cold air moves through the floor of the nose. So any ear, nose, and throat doctors who are watching, please take heed and consider alternative treatment options for the inferior turbinate. Okay, so what is it? We're back in the fishbowl, and we've turned to Wikipedia, that fund of awesome medical knowledge. And I just want to, here's this could have been the CT scan of my patient the other day. The inferior turbinates here have been resected. It's interesting that this gigantic concha bullosa is still there, and this is a pretty big middle turbinate there. So, that looked a little bit like my patient the other day. But let's read this. Empty nose syndrome, one form of a secondary atrophic rhinitis, which means that the nose has changes along the mucosa. They claim it's a rare clinical syndrome. They are wrong. It is not rare. We see a patient almost once a week with this, in which people have clear nasal passages, experience a range of symptoms, most commonly nasal obstruction, nasal dryness and crusting, and a sensation of being unable to breathe. And we discussed why that's the case. Air is flowing along the floor of the nasal passageway, and you cannot feel it move through the upper 90% of your nose. And when you have that much air moving across your mucosa, it will cause excessive dryness. And the crusting is something that could be managed for many people. Even if you have an empty nose syndrome, sometimes that could be managed with some topical ointments and whatnot. They've usually undergone turbinectomy, true, which is removal of or reduction of the turbinate structures inside the nose. Or they've had other surgical procedures that interfere with the turbinates. Overall incidence is unknown, but it appears to occur in a small percentage of those who undergo nasal sinal procedures. That's probably true too. It's not the majority. You're probably safely going to have your nasal surgery, but it's not rare. And then it says it appears to be a healthcare caused condition, which I have problems with that. They're assigning blame. Wikipedia. Wow, you guys are so freaking knowledgeable. So you guys aren't all that smart. You don't know what's causing it because no one knows what's causing it. And it may be true that some people are more inclined to get it for other reasons we don't understand. I think the take-home point, the teaching point, is that less is more. You want to preserve normal anatomy. You want to redirect nasal airflow. Please see my video on physiologic nasal airflow. This is a coin that's been, a term that we've coined here at the Modern Nose Clinic, which means we made it up. But I like it, and it explains what we do. All right. So to my patient who I spent an hour with last night, and to the person who left the comment on our video, physiologic nasal airflow, for any of you out there who may be suffering from empty nose syndrome, I'm really, really sorry. And that is not something that I wish upon anybody. And this is actually one of our little surgery rooms here. Kind of cool. It's actually a clinic room that we convert into a surgery room. Please ask any questions in the comments section. I can't really give medical advice per se, but I thought this could be useful for anyone who would like to learn more about this. If you're thinking about surgery, the Modern Nose Clinic, we have a very modern approach to nasal surgery where we preserve normal anatomy. And to the best of my understanding, we have not had a single case of empty nose syndrome in the 11 months of our existence. So we'll try to keep up that track record. Take care. Signing off. Doug Skarada, Modern Nose Clinic. We know your nose.